My name is Charlotte Mather-Taylor, and I'm the Executive Director of the Area Agency on Aging of Broward County. We are a nonprofit organization. We plan, develop, coordinate, and evaluate programs, provide services, fund services, and are the prime advocate for Broward County residents 60 years of age or older. This video is brought to you by our Dementia Care and Cure Initiative Task Force, also known as DCCI. The DCCI Task Force is part of the Florida Department of Elder Affairs statewide network of task forces committed to creating dementia caring communities throughout Florida. One of our goals is to increase education, awareness, and sensitivity regarding the needs of people living with dementia and their caregivers. We hope this video will provide you helpful information to assist you in caring for your loved one. If you have any questions regarding this video or are seeking resources, please feel free to reach out to one of the phone numbers behind me on the screen or our website at www.adrcbroward.org. Thank you.
My name is Milena Cedeno-Oblinger. I am a registered nurse and a certified dementia practitioner working at the Broward Health North Memory Disorder Center.
Hi, and I'm Tim Curtin, the Executive Director of Community Services with Memorial Healthcare System.
We'd like to share with you today some tips on supporting loved ones with dementia in the hospital. The first we'd like to share about is an unplanned hospitalization or a hospital emergency. This can be a very tiring and frightening time for the person with dementia. You always want to ask a friend or a family member, if possible, to come with you, to meet you at the hospital. This person can assist with staying with the individual while you answer questions to the ER staff. Be ready to explain the symptoms and events leading up to the ER visit, possibly more than once to different staff members. Tell ER staff that the person has dementia and explain how best to talk with that person. You want to comfort the person, you want to stay calm and positive. Your feelings will get absorbed by others, so try to remain calm. Be patient. It could be a long wait if the reason for your visit is not life-threatening, and results may take time. Do not assume the person will be admitted to the hospital. And prior to leaving the emergency room, have a plan. And if you are sent home, make sure you understand all instructions for follow-up care. Tim?
Sure. No, thank you for that. And you know what, really, it sounds obvious, but stay with the person the whole time in the ER. Use your cell phone to play some soft, light music, because ERs, by the nature, are hectic. They can be loud, a little chaotic, and that can be difficult for someone, challenged with dementia. So trying to keep that person calm, like you say, is very, very important. Discuss with the doctor and the staff any communication issues, and ask them to limit the questions to the patient just to get accurate information. And again, just trying to keep them calm and alert, I guess, as to what's going on is very important.
Hospital staff. So contrary to what you may believe, hospital staff and ER staff have limited training in Alzheimer's disease and related dementias. Try to help them better understand the person as an individual. Encourage hospital staff to see the person as an individual and not just another patient with dementia who's confused and disoriented from the disease. Hospitals are not typically well designed for patients with dementia. Ask the doctor, like Tim said, to limit the questions to the person who may not be able to answer them accurately. Instead, talk with the doctor in private outside the person's room. Tell the doctor immediately if the person seems suddenly worse or different. Medical problems such as fever, infection, medication side effects, and dehydration can cause delirium, a state of extreme confusion and disorientation, and they're also very commonly seen in the hospital. Provide a personal information sheet, which includes the person's normal routine, how he or she prefers to be addressed, personal habits, likes and dislikes, possible behavior triggers, how best to respond, nonverbal signs of pain or discomfort, and help staff understand the person's baseline, their prior level of functioning, to help differentiate between dementia and acute confusion or delirium.
Sure. You know, I think you said a lot of things there, and I think they're all important. But even so, and the limited training is really important to know. So if a caregiver is you know, coming up and the patient is issued a room that's close to the workstation, the nurse's station, or in a high traffic area, you know, the caregiver can ask for a quieter room because maybe the hospital staff isn't thinking that way. So there are some practical solutions that the caregiver can understand if they.
And there's not always the staffing resolution there, you know, the
Right.
staffing to be able to safely monitor that patient constantly.
Right, and then, you know, the caregiver alerting the hospital staff if there is a wandering issue, just so they know before it happens.
Right. So the planned hospital stay. So now we've talked to the physician and there is a planned hospital stay to be had. And with Alzheimer's disease and related dementias, it's wise to accept that hospitalization is a when and not an if event. A lot of persons with Alzheimer's disease and related dementias have chronic medical problems that need to be addressed at times in the hospital. Think about and discuss hospitalization before it happens. Make a plan. And as the disease and associated memory loss progress, involve the person with dementia in the planning process as much as possible. Everybody's at a different stage in the disease process, and if it's possible, discuss hospitalization, then do so. Talk with the care team to see if hospice may be a better and or appropriate alternative. Build a care team of family, friends, and or professional caregivers to support the person during the hospital stay. Do not try to do it alone. Ask the doctor if the procedure can be done in an outpatient setting. If not, ask if the tests can be done before admission to the hospital to shorten the hospital stay. Ask for a private room with a reclining chair or bed if insurance will cover it. It will be calmer than a shared room.
Yeah, and even before getting to the hospital, just even packing for that hospital stay, if it is planned, insurance cards, medicines, any kind of medication issues, healthcare providers' names and numbers, snacks for the patient, incontinence briefs if necessary, comforting items. I know we mentioned those, but iPods or any kind of music player, and always have a pad and pen as a caregiver because it's rapid fire. It's very quick. There's a lot of information, and you need to write it down just to be able to process it sometimes.
Absolutely. And a medication list. Always have an up-to-date and accurate medication list. There's a great app on your cell phone too, which you can take down notes. If you don't have a pen and paper, you can type down notes on your cell phone. You know, we never leave without that. Anesthesia and medications. Ask questions about anesthesia. There may be catheters involved. There may be IVs involved. The person with dementia gets very confused and agitated. And so if those things are necessary, if not, what are some alternatives? Just to avoid potential harm to the individual who may get confused and try to pull those things out. General anesthesia can have side effects. And so ask if local anesthesia is an option. Ask if regular medications can be continued during the hospital stay.
Mm-hmm. Yeah, that's very important that, you know, the patient is kept calm during that process. A lot of times people will be touching them and holding their arms, and that can create, you know, even further frustration and a stressful
Agitation.
Yeah.
Communication, some communication tips. Do not talk about the hospital stay in front of the person as if he or she is not there. This can be very upsetting and embarrassing. Tell the person the two of you are going to be spending a short time in the hospital together. Have a family member, a trusted friend, or a hired caregiver stay with the person with Alzheimer's at all times, and if possible, even during medical tests. This may be hard to do, especially during these times during COVID where they're limiting visitors or in certain areas with diagnostic tests and procedures where visitors are not allowed, where the area needs to stay sterile. But to the best of your ability to stay with the person will keep that person calm and less frightened, making the hospital stay easier. Ask friends and family to make calls or use emails or online tools to keep others informed about the person's progress. Help the person fill out menu requests for their food. Communicate with the person in the way he or she will best understand and respond. So for example, if the person is always called dinner supper and you use the word dinner or vice versa, that may become a confusing conversation between the nurse and the patient. So there are some more familiar communication words and better ways that this person or individual may understand and respond. Language barrier as well. Talk in a calm voice and offer reassurance, and repeat answers and questions when needed.
Yeah, and you know, the caregiver, the loved one, typically knows those facial or nonverbal cues, how the loved, you know, the loved one with dementia is feeling. So share what those cues mean, if it's a facial expression or a hand gesture, so the hospital staff knows of those. Any sleep routines that the patient is used to, whether they like to take a nap at this time or that time, trying to keep them in some kind of routine is really important. You did mention
routine is very important.
Yeah, you mentioned the food and the diets and filling out the menu, any special diets, any kind of snack or food preferences are important. Yeah, so personal items, again, trying to bring pictures from the house if that's something that will help comfort that individual.
There's some things that you can do while you're at the bedside and waiting on procedures and waiting for results. You can help open food containers. You can remove trays. Assist with eating as needed. Remind the person to drink fluids. Dehydration can be an adverse side effect to hospitalization. So offer fluids regularly if they're allowed to drink, and have him or her make frequent trips to the bathroom. Assume the person will experience difficulty finding the bathroom and or using the call light or the bed adjustment buttons or the phone. Recognize that unfamiliar places, medicines, invasive tests, and surgery will make a person with dementia more confused. He or she will likely need more assistance with personal care. Make sure the person is safe and tell staff, like Tim mentioned, about previous issues of wandering, getting lost, falls, suspiciousness, and or delusional behaviors, and sometimes hallucinations. Do not be afraid to be an advocate. Plan early for discharge and ask the hospital discharge planner about eligibility for home health services, equipment, or other long-term care options, and prepare for an increased level of caregiving.
Yeah, I think they're all important. The ones that stick out is just the bathroom's always an issue because it's an unfamiliar place or direction. So really be careful for the caregiver to keep an eye on that and assist them as needed, or get the hospital staff to assist. Be available when the doctor rounds, so the caregiver does speak to the doctor. That's really important and avoids a lot of caregiver frustration because we just went down to the cafeteria and missed the doctor by 5 minutes.
Right.
And that's always frustrating, right? And then, like you said, ask a lot of questions about social services. What is the follow-up plan in terms of, what's the next steps? And I think that's important to leave the hospital with.
Yeah, frequent trips to the bathroom are important. It's almost the majority of falls, unexpected falls in the hospital is the confused individual wanting to get up and use the bathroom, but not asking for assistance and not knowing how to do that while they're connected to tubes and wires and such. And then the last topic I wanted to cover with you, Tim, was the anxiety and agitation. So how do we reduce and manage anxiety and agitation during the hospitalization? Remove, and I've learned this the hard way, remove personal clothes from sight. This may remind the person of getting dressed and wanting to go home. Post reminders or cues like a sign labeling the bathroom door if this comforts the person. Turn off the television, the telephone ringer, and the intercom. Minimize the background noise to prevent overstimulation. talk in a calm voice and be patient, provide a comforting touch or distract the person with offers of snacks and beverages. And this one is huge. Consider unexpressed pain, a furrowed brow, clenched teeth or fists, kicking. Assume the person has pain if the procedure or condition is normally associated with pain. Ask for a pain evaluation and treatment every 4 hours, especially if the person has labored breathing, a loud moaning, crying or grimacing, or if you are unable to console or distract him or her. And like you mentioned, Tim, playing soothing music, other comforting rituals like reading, prayer, singing, or reminiscing to keep that individual calm. Slow down. Try not to rush the person, especially after surgery. You got to slow down and take your time, be patient. Even with communication, the person with dementia takes a while to process information, and they may take a while to respond or process their environment. Avoid talking about subjects or events that may upset the person.
Yeah, I think when it comes to any level of hospitalization, the reality is that the caregiver needs to prepare for an increased level of caregiving. It's a different environment. It's a lot of strangers to the patient. There may be, like was mentioned, some paranoia or some suspicion can kick in, and that creates that agitation and anxiety. And you mentioned a lot of the areas to really look for and what to do. But one thing I would like to add is that sometimes it's just kind of looking at making sure the eyeglasses aren't missing, or the hearing aid didn't fall out, or the dentures aren't missing, because that starts that level of anxiety and agitation, and then it builds from there. So it can be something simple that can be resolved, or it could be more.
Right. The sensory deficits are huge. You know, if the person can't hear, if the person can't see well, it not only is it not safe, but, you know, they're going to be more confused. And that's definitely a good point.
And that's our presentation. For more information, please see the resources listed on the next page. Thank you very much.
We hope you have found this video educational. Remember, you are not alone, and there are many resources out there to help you. The next slide lists some very important resources that you can connect to seek additional assistance. In addition, remember the Area Agency on Aging of Broward County is here to help. Our phone number, which is behind my screen, is 954-745-9779, which is our direct helpline, as well as our website, www.adrcbroward.org. Wherever you live in the state, you can reach out to also the 1-800 number also behind me on the screen. That's 1-800-963-5337. That number will connect you to an area agency on aging in your area. Thank you.